Good afternoon. I'm Sheila Murray, Chair of the Berkshire Brigades, which is the Berkshire's County Democratic Organization, and we're committed to education of the public about our political process and also in support of local, statewide, and national Democratic candidates. So today, for information, we have Nat Karns, the Executive Director of the Berkshire Regional Planning Commission. Is that your full title, or do you have more to
that's
it?
That's my title.
Okay. And so, Nat, wanted to just tell us a little bit about your background.
Sure.
What got you here, and then tell us about, first off, what the Berkshire Planning Commission does.
Okay. Well, why don't we start with the important stuff first. The Berkshire Regional Planning Commission is officially a sub-state district. So we are a governmental entity created under Mass General laws to provide regional planning services within Berkshire County. Our actual mission is to provide technical assistance to the 32 towns and cities in Berkshire County, to act as a forum to discuss regional issues and to advocate on behalf of the Berkshires, particularly with the state and federal governments. So that's really what we do. Each community has a planning board member who is the delegate to the commission, and each community has an alternate appointed, who may be any citizen of the community, appointed by the mayor, town manager, select board, depending on the exact form of the local government.
Mm-hmm. And do you meet on a monthly basis? Or
The commission meets every other month. We have an executive committee that meets monthly, and then we have various committees that meet on a whatever basis happens to happen.
So the full commission of the representative from each town, that's every other month?
Every other month,
I
yes.
see.
So they
Okay.
have a meeting coming up third Thursday in November, the 16th, I think that is.
Okay.
I think
Are
I'm
these
off on the
meetings
dates.
open to the public?
They are, yes.
Oh,
We're governed by the open meeting law, public records law, all of those things, and certainly if people want information on the commission, we try to have that on our website, which is www.berkshireplanning.org.
Okay, that's easy enough. That's definitely easy enough. So then now, what does the commission do? I mean, there's a lot of services I noticed
yeah,
from checking out your website.
Well, our traditional services were really physical planning issues, transportation, land use, economic development, not necessarily programs, but the physical aspects of those things. So, we would provide zoning assistance to the municipalities. Many years ago, almost all the municipalities in Berkshire County adopted zoning. One of our staff people at the time was the one who worked with the planning boards to develop their zoning bylaws, and we still do that kind of work. Master plans, open space plans, that kind of thing. That really was our bread and butter for a long time. Increasingly now, we're getting into things of providing services on a regional basis. So that, for instance, we run a regional brownfields assessment and cleanup program. We just received a very nice infusion of new cash into our revolving loan fund that actually helps clean up sites. So, we're running almost a $2 million revolving loan fund to clean up contaminated sites in the region. We have a public health alliance that is providing public health services on behalf of the local boards of health, and that's an important dynamic in our region. Is certainly we respect that the municipalities are still important to people. It's we're not Kansas with county government doing things. We rely on the towns and cities, and the policy boards are the ones at the local level are really the ones who drive these programs. Kind of a broad range of things. We've always been a data source for the county. We have under BerkshireBenchmarks.org, you can look up the data on any community in the county or the county as a whole. It's a very, it's used.
Demographics
And demographics,
lands.
economics, education, any kinds of data from official sources. We don't do much original data collection. It's really just assembling information that's available elsewhere, but concentrated on the county.
Right. Oh, interesting. And then education. What are you doing with education? Are you involved in these schools?
Well, we sort of are.
Rebuilding, new build, school seems to be a big issue these days.
Yeah, schools are a big issue. And our involvement really derives from about a year ago or so, we had done an in-depth look at what was going on with our population dynamics. And that led to a much deeper appreciation, certainly with us, but I think in a lot of groups and people around the county about what was going on in our demographics in the county. Lack of young people, lack of young workers, more elderly, that sort of thing. So we were requested to provide information to, first it was a working group of the Central Berkshire Regional School District who was looking at their enrollment declines, and of course they were dealing with the needing to make a decision about the school in Cummington and whether that was going to remain open or not. So they were really into the really tough decisions thing, but they asked us to come in and present data to them, and then asked us to start developing new data on what enrollment trends looked like they would be in the short term.
Okay.
And the next 5 or 10 years, frankly, are pretty given. The 5 years out, well, all of those kids are already born and pretty much living in the county.
Right.
So you have a very good handle on what the school enrollments will look like for the next 5 years. And unless something incredibly dramatic that none of us could foresee happens beyond that, certainly in the next 10 years, that same trend is basically there. So we've been providing that kind of support to what has now evolved out of the Central Berkshire Committee into a county-wide task force with representatives from several of the municipalities. Every one of the school districts has been involved in some form or another and is at the table. That's been meeting since July, just recognizing that we have something pretty dramatic going on that we need to make adjustments to. So we're kind of providing technical support to them.
Okay.
We're not education experts and wouldn't pretend to be. My opinions are my personal opinions on those topics. That isn't the commission's role, because that's not where our expertise lies. But certainly looking at the raw numbers and what's going on and providing
you
those.
Make recommendations, or
Well, not necessarily recommend. The task force will come up with recommendations.
Okay.
We wouldn't do that.
Right.
That's outside of anything, and we'd be comfortable with.
So when we start looking at the aging demographics of the county,
Yes.
that seems to be a big issue. We really seem to have quite a spread,
Well,
or a gap,
yeah,
so to speak.
Yeah, and this derives from what's been going on to our economy for 40 years and our overall population structure. So what we have is a loss of younger workers. You look at our countywide age profile, and we are way below in the 21, 22-year-old to about 38, 40-year-old.
Almost the millennials.
The millennials,
right.
right. We're way down here, and Massachusetts is here, and the U.S. is above Massachusetts. So we have that dynamic there. And then on the other side, 50 plus, we have more people. So us baby boomers are the ones that we have an overrepresentation on.
Right.
And and some of this, it's it's one of those things of what happens over here also impacts what it looks like over here, kind of when you look at those profiles. So to some extent, the picture is slightly exaggerated, but nonetheless, it's a very real picture. And we actually crossed a magic point, not necessarily one we want to cross, back in 2011. We now have more 65-plus-year-olds in the county than we have people under 18.
Wow.
And this is a line that Massachusetts and the U.S. as a whole will cross about 15 years from now. It's estimated about 2030 that will occur in Massachusetts as a whole,
right,
and in the U.S. Now, this dynamic's one that Western Europe, Russia, Japan have been dealing with for at least a generation.
Right.
Japan, it's a sign of a more advanced, mature population profile, really.
And living longer.
Living longer.
That has a lot to do with it.
Yes.
Yeah. So what is the involvement of the Planning Commission with these populations? Is there?
Well, there there are a lot of things going on.
Okay.
So let's sort of on the taking care of those of us who look more like me. Last year, countywide, an age-friendly task force was created. And this involves multiple, I think there are about 20 organizations that are active in this task force. And actually this about, last spring, April I want to say, we were designated by the World Health Organization and ARP as an age-friendly community. To our knowledge, we may be the first county in the United States to be designated that way.
Yeah, I didn't
most of the places have been
involved in that. Yeah.
You know, most of the places that have been designated were cities or towns. In our case, we did it as a county effort, and we're successful in getting that designation. And what that really does is bring us more resources to think through this problem. And it has a lot of implications. We did do an age-friendly survey. We also did one of younger adults, but we did one for older adults, both of them last February and March. Had a great response, about 2,600 responses. Not a scientifically, statistically valid survey, but enough responses you can get a lot of information out of it and have some comfort that it's painting a reasonably decent, clear picture. And it was interesting to note that we did both these surveys at the same time, and the valid results were about the same numbers for both. But there are some real commonalities of what the young folks want and what the older adults want. One prime thing that comes up, and it comes up in a lot of discussions in the county, is how do we start tackling our poor public transportation?
Oh, yes.
Elderly folks increasingly need access to transportation. They may be uncomfortable or unable to drive themselves as much. Young folks would prefer not to have as many cars, and that's coming up all across the country. That's coming up in surveys, that they just as soon not have cars if they can get away with it. Both populations want to live in places where they can walk down the street and get a cup of coffee, or go in and pick up a bagel or whatever it is, go to a social activity and not have to drive for 10 miles to do it.
Right. Or just grocery shopping.
Yeah, or just any of these things. You know, they would just as soon their daily activities, even their work, be someplace they can walk to. And, you know, I think that speaks to some of the things that we certainly support in the county to provide assistance to the municipalities on. For instance, let's clean up our zoning bylaws so that more mixed uses are allowed in the town centers and the city centers. So a few years ago, we assisted Pittsfield with several zoning changes to make it easier to build housing in the downtown.
Oh, I see.
And that's certainly, you know, the days of the 1950s, we were all trying to move to the suburbs and be away from downtowns and be away from commercial things, and that has kind of been totally turned around of many people want to be in places, again, where they can walk 2 blocks and go to the drugstore, get a cup of coffee, whatever it is that they're trying to do that morning or evening.
Right.
So, you know, that's part of where our role comes in. The Berkshire Public Health Alliance, which is under us, has been one of the leaders in this age-friendly task force. The dealing with elderly health needs is something that clearly ends up falling in a public health sphere as well as a, you know, general medicine sphere.
Right.
So we're involved in that way. We do transportation planning. So one of our studies this year is to look at, is there a mechanism beyond the BRTA and the financial limitations it has to provide more service? Are there other ways we can be providing more transportation options for people in the region, older or younger?
Do you see Uber coming? Do you see Uber coming?
Well, that's one of the things we want to explore.
That's
You know, what are the dynamics that an Uber or a Lyft would, you know, what are they looking for, and how, you know, what do we need to do if that's an option?
Right.
And I'm not saying it should be the option, but it's something to at least explore and understand.
Well, I know I am probably new to the Berkshires of 7 years coming from the city, and I'm in West Stockbridge, and it was like, there wasn't even a taxi to call. You know?
Right.
If I needed, my car broke down, if I needed a ride, what do I do? You know, and that's where
your
neighbors. You got to get close to your neighbors.
Right.
You know, they might be a mile and a half away.
On one hand, that's a good thing.
Right.
And on the other hand, it's not always the way. You know, what's the right way or good way.
But if there's people hanging around and need some work, and there's an Uber available, then, you know.
And that whole topic of public transportation or lack of it comes up. I was having a conversation with Ellen Kennedy, the president of Berkshire Community College, a few weeks ago, and she was saying that was something they were interested in, both as a way for students to get to and from class, but the other part of it was as a way for students to possibly earn some money, since college affordability is a barrier for so many of them,
right.
Particularly many of the students that the community college serves. So, you know, she popped out with this, and I'm going, okay, well, I'm hearing this from somebody else.
Right.
You know, so we've heard that, and it's something certainly worth exploring.
Yeah.
And so that's the kind of thing we would do.
That would be something you would do.
Yes.
Okay.
Yes.
All right.
Now,
and then
we would not necessarily be the ones who actually get it done.
Right.
We would try to see how that would, you know, how do those things get started? I have no idea, frankly.
So you provide the information to the agencies or organizations that can implement whatever it is that you find out.
And then in some cases, when there is no such entity or organization, I mean, that's why we run a regional brownfields program, for instance.
I see. You're running that yourselves.
If we were in Virginia, where I came from originally, a county government would be running that program.
Right.
In our case, we don't have that as a mechanism. We still have the need, so that's why we do it.
So you take it.
Right. And you know, and I'm not saying that with something like trying to get Uber here, that would be something we would take the lead on. We don't, well, we'd have to see how that gets done.
Well, there is a Department of Transportation in Pittsfield, isn't there? Is it?
No.
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 Okay.
No.
Right. See, I'm still city thinking.
Yeah, no, I mean,
Well,
our
regional
communities
transit.
we have the Regional
transit,
Transit Authority,
right.
but they're a
Okay.
traditional regional transit authority.
Right.
And that's really what their mission is to provide more traditional transit service.
Right. Okay. And that might be what they need to even look at, is expanding that traditional.
Well, they might, yes, yeah.
Yeah, something.
Yeah.
Okay, so what other, as far as the public health now, it's transportation is one of the issues. Do you work with the local towns and when they're setting up their flu clinics and things like that? Or
well,
Department of Aging?
we run the flu clinics for them. So
Okay.
we actually have, as contractors, several public health nurses. We take care of the paperwork, and we help the local boards of health set up their flu clinics, do that, have the nurses come in. Our staff takes care of the paperwork, does the reimbursements to Medicare or Medicaid or to HML Blue or whoever.
Right.
That pay for those things. A few years ago when there was the scare over H1N1 flus, we had about, I don't know how many doses of flu vaccine were run through the Berkshire Public Health Alliance.
I see. Okay.
We also have inspectors who are actually part-time employees who do provide inspections on the request of the local boards of health. So this is a voluntary thing. They contract with us to provide some of their inspections. I mean, if you look at what the range of things that a Board of Health has to accomplish. It's everything from immunizations, tracking communicable diseases in their communities, swimming pool inspections, septic tank inspections, well inspections,
restaurants,
emergency preparedness. So they're very involved with the Western Mass Regional Homeland Security Council that is, tries to be in some state of preparedness for what if a natural or human-caused disaster occurred. How are we prepared to respond? So they try to deal with that. So the Health Alliance is very active with that group.
And this is all part of the commission?
This is all under the commission.
How big is your staff?
Our current staff is 21 full-time people.
Oh, that's a good size.
Yeah. I mean, I think we've been strategic. We don't try to cover, again, like something like education outcomes. That's not anything we've got in our stable at this point. But where these things do crop up, and again, the public health work, it started off really with, for a long time there's been a public health alliance in the county or a public health organization of the local boards of health would get together for training, try to run some programs. Well, they suddenly realized they needed a fiduciary agent to manage grants or resources that they were getting, because they didn't have the organizational infrastructure to do that.
Right.
We're used to working in that world. We've had full federal audits every year that have been totally clean forever. So, we know how to run the books and run the programs in a legal fashion that the state or federal agencies that do the funding are comfortable with how we do it. So we started providing them that service, and as it evolved, they started to talk about, well, we have trouble getting an inspector to do this or that for us. And a lot of the inspectors require certifications. So, you're a small local board of health and you get 2 calls a year for this, whatever this is. Well, you don't necessarily have the expertise, and these are all volunteers.
Right.
You know, and most of our towns are very small. So, yeah, I mean, really, it's a service that we were able to provide, and it falls in that providing technical assistance to our municipal governments
Right.
role that's sort of our lead role.
It's amazing. I mean, I thinking of the Regional Planning Commission, I never would have put public health in there. I just, not something that I had considered. Now, is there something, with just a minute or so left, we have, are citizens in touch with you? Do they contact your department? Or is it all through the kind of sub-agencies or the subgroups that you deal with? That they come, they go
citizens
through?
do contact us, and we have just general citizen members on some of our committees. I would encourage citizens who are interested. Some of our communities have never or have not, don't have active alternates, for instance. So these are the folks who are appointed by the mayor, town manager, or select board, and in many cases the alternates are more active on the commission than the delegates are.
Right.
And some of this is because our range of services has expanded so much beyond traditional land use planning and just doing master planning and zoning support, that sort of thing, which is the planning board's role. And it's frankly, my personal opinion is the state law is a little archaic, that it requires the planning boards be the ones who appoint the delegate. But it was written in 1950 something, and it hasn't been changed in those 60 years.
So,
You know, and I guess when they wrote it, they thought, well, planning board. But really, in reality, much of what we do has more relationship to general government roles and functions than strictly planning board functions anymore.
well, I appreciate you coming in today, and
Glad
thank
to.
you very, very much. It's been very educational for me, and I'm hoping for our viewers as well.
Well, I
Thank you.
appreciate the opportunity.
It's
Thanks.
good to meet you as well.
Okay.
Thank you.